Let's go ahead and get started this morning. I want to say welcome. Welcome. My name is Seisha Bonner, and I'm a member engagement specialist here at Partners. I'm part of the member engagement team. I want to thank you for joining us today for our annual event focused on IDD or intellectual developmental disabilities. Today, we have some wonderful ladies joining us today. Our partner staff that will be helping and joining, keeping this event educational session going. We have first Latasha Scott, and she's our health educator. She will be our production manager and question moderator, as well as our Zoom producer. So thank you, Latasha. Next, we have Kimberly Lambert. She will be our resource guru, and she will be entering information into the chat for you, links, resources, any type of thing that would be helpful in moving forward. She will place them in the chat box for you. And then we also have Ann Gluff here. Ann will be, there she goes waving, Ann will assist with moderating and our questions. She's going to control our question and answer portion, and we'll talk a little bit more about that later. Today, we are offering sessions in closed caption. If you do not need this feature, you can simply hover over your live transcript and click hide subtitle. For those who are new or not really familiar with Partners, we are a managed care organization. Here in North Carolina, we have 14 counties, and we provide services and resources for mental health, substance use disorder, IDD, TBI, and some state-funded services. But we can go over that a little bit later and give you an overview of us. Before we move forward, let's go over a few housekeeping items. Again, this meeting is being recorded, so make sure you have a pretty face on, smile as much as you can. That's a note for myself, actually. The meeting again is being recorded. Please do not share any sensitive personal information during this call. As the meeting is recorded, we do not want your information or a specific member question published across, the World Wide Web. Partner staff is available after the call for individual issues you may want to discuss. That's why we don't want you to put any of your information in, so we can just help you one-on-one if you're needed any assistance or resources. And we can schedule a time one-on-one to talk with you based upon your availability. The PowerPoint slides will be shared with you after the event. Please feel free to put questions in the Q&A. That's throughout the course of the presentation, and we will try to get all the questions together, and we can ensure that you have all your answers or provide you with the resources that you may need for today. So next, we're going to take a look at the agenda. So this is what we're hoping to get out of today. We want to talk about the physical and emotional impacts of puberty. Our goal, or our kind of saying throughout this entire presentation, is we're trying to normalize this. These are normal phases in every human body, male or female, no matter what your gender, race, creed, disability, or non-disability. These are normal things, but we want to make sure that we are explaining and normalizing your feelings, your emotions, and what you may have went through, or what you may have embarked on, or in the future, or maybe someone that you may know. So we're going to be talking about the physical and emotional impact of puberty. Then we're going to talk about the vital role of the parents at the IEP table. We all know that the IEP is a very important part of planning moving forward, or in your current stage, as well as planning for future reference and adulthood. So we're going to talk about the importance of that and ensuring that parents know their vital role and know their the importance of it for their child or loved one that they're caring for, as well as themselves. We're also going to have a parent panel, and this parent panel, we have parents who have went through these phases that we're talking about, and they can give you some firsthand knowledge and kind of like a light at the end of the tunnel. So you can know that you're not alone, and you can know that, we all need someone to know, to be able to look at and say, hey, they made it through. I can as well. So that's our whole point of it. And we have two lovely mothers who have agreed to be on our panel as well. And we're going to have some giveaways, but we'll, talk about that a little later as well. But we will have some prize giveaways for some participants. And we'll give that toward the end of the session. And then we'll have closing remarks and everything. We are really excited about this. So first up, we have Christy Myers. She will speak about the physical and emotional impact on puberty. Christy Myers is Director of Integrated Health for the ARC of NC. Christy has 27 years of professional experience in supporting people with IDD and autism in both community and state developmental centers. She has spent her career providing direct support, management, and advocacy for the integrated person-centered care of the population. As a part of her role with the ARC of NC, she's worked with the IDD Medical Health Home Initiative to support statewide projects and initiatives to expand the delivery of services and supports for individuals and families to achieve their full potential. Christy will provide information for parents, caregivers, family members, and loved ones on the physical and emotional impact of puberty involving our individuals that we serve with IDD or autism, and how to support them through this transition. The next voice you will hear will be Christy Myers. Thank you, Christy.
Absolutely. Thank you so much, Seisha. And I am super excited to be here with everybody today. This is a really important topic that oftentimes we find is difficult. It's difficult for families. It's difficult for our kids, um, all around. And oftentimes it is a topic that doesn't get a whole lot of attention, but it's so important. So I'm really, really happy to be here today to talk about how we can support our children with intellectual and developmental disabilities as they are transitioning through puberty and adolescence. I think that, obviously puberty can be an incredibly confusing time for all teens, but may present additional challenges, obviously, for teens that have special needs or intellectual and developmental disabilities, as well as their families and caregivers. It's really important to just kind of start with that your teen is going to experience the exact same types of body changes, hormone fluctuations that all of their non-IDD peers do. And so we need to really be prepared on how to support them through this time, how we partner with others like our healthcare provider, our counselors, our schools, to make sure that we are addressing all of those needs and making sure that they have all the supports necessary to transition through this time as best we can and give them all of those great tools that are available. When it comes to onset, the typical onset for people with disabilities is really pretty much the same as for other teens. On average, at age 12 for girls and age 14 for boys, but we know this varies very widely based on the person. It can actually be in a range between 9 and 14 years old. Typically, our females will experience it more quickly or earlier on than our males. And so just things to be thinking about when we're looking at ages, when we're starting to want to really monitor for those changes that come along with that transition into puberty. There are situations where some of our teens may have start puberty maybe slightly earlier or later, than their peers. Typically, our first periods or menstruation is going to occur between 2 to 3 years after the start of breast development. while for males, that would be after the enlargement of scrotum and testes. So those are the first types of changes that you would see, or changes in growth of those private body parts. So we want to be able to emphasize right away that these changes are normal, and that, it's really helpful for our teens to understand what's going to happen, having those conversations with them, why these things are happening, so that they know what to expect. And it's less confusing to them. They're expecting it to happen, and makes them more comfortable with that, because all of these changes can cause a great deal of anxiety, and stress, and people who are, working through this puberty transition. Um, but the bottom line is, children with IDD, they're going to mature physically and sexually, just like adolescents who don't have disabilities. And although sometimes that timing can differ, they're going to experience those same things. So, um, a couple of different types of experience we have found is that for females with autism spectrum disorder or cerebral palsy, may start menstruating later than their peers. So that's something to just be, thinking about. And sometimes just based on a certain diagnostic, sometimes people with IDD will experience puberty earlier than those without disabilities. So it's helpful to have these conversations with your healthcare provider, and be thinking about, before this all happens, how we want to break down those conversations and be able to support our children and our loved ones going forward. Next slide, please. So, as you know, we all went through this ourselves. I can remember it well, and I know my parents can remember it well. It's not an easy time, right? There are so many hormonal changes that are going to affect the basically whole health, right? Physical changes happen, sexual changes occur, and then there are very intense social and emotional changes that occur throughout that puberty transition. Um, Talking just a little bit about some of those physical changes that happen. Both females and males are going to have those growth spurts. They're going to start to develop body hair growth. They're gonna experience excess sweating. So, and skin changes like acne. So hygiene becomes really important. And that's sometimes one of the things that we really have to work on, supporting our teens to make sure they're really taking good hygiene measures to keep themselves clean. And then, of course, once our females do start to menstruate, really helping them with how to take care of those menstrual needs. How are they going to support, whether they use pads to help with their menstruation, or they're going to use tampons and things of that nature. So lots and lots to consider going forward. Specifically for females, we're going to start to see breast growth. And as I said, menstruation, they'll also start to have that vaginal discharge. They, of course, may have cramps associated with that PMS, or premenstrual syndrome. So lots of physical changes that we are going to have to support our folks in learning, education, how to support, and using all those good resources that are available to us on how to help them at their level of understanding, using lots of repetition when that is needed. So there's lots out there to help us start these conversations and then support them as they are moving through the transition. For males, we'll start to see enlargement of the penis and the testes. This is also a time where we start seeing nocturnal emissions, or wet dreams. And then also involuntary erections. And I know this can be super scary or embarrassing for our males. So it's, again, having these conversations, what to expect. And then, of course, there's that deeper voice that, is actually sad for a mother, I will have to say. I can remember when my son and his baseball team, he played baseball with guys since he was 4 years old, and all of a sudden, all their voices changed. And I was like, oh, this is so sad, just because we know they're growing up. And sometimes that's hard for us. Um, in addition to those physical changes and those sexual changes that they're going to start having, there's also the social and emotional changes that happen during puberty. And they can include things like desire for more privacy, as well as increasing the need for independence. This is a time where people are really kind of find out who they are and really identify with themselves. And during this time, you may notice that your child's feelings and expressions of those feelings become much more intense. So that is normal. We expect that, and we can remember back to ourselves and see those same things. So we can expect the same things from our children. Sometimes those changes can be large or small, depending on that person's developmental disability. Next slide, please. So, how do we help our children navigate through puberty? One of the most important things that we can do is start those conversations early. The sooner we can start bringing up and breaking it down, what's coming first, and kind of starting slow and moving forward, building in repetition. Um, One of the things we want to ask is what they already know. We know our kids, they hear things in school, they hear things from their peers, they hear things from conversations from adults that they're listening in on. So it's always good to ask, what do they already know? And kind of get a gauge, because what they already know may actually be some of that stuff may be incorrect. And so we may need to help them, educate them on the correct information, different from what they may have already. And like I said, we want to break it down into terms that they understand, break it down into specific parts of that transition in puberty, of how we're expecting them to move forward through that, and starting slow and just building on each topic that we talk about. Um, we do want to make sure we're using direct and anatomically correct language when we are talking about those body parts. It's really important that we're using that correct terminology. And then we are getting into those discussions about those physical and emotional changes that will happen as they are moving forward through that transition. Um, we want to make sure that, we're having these conversations ideally before they've experienced them. We want them to be able to prepare them for these experiences so that it doesn't scare them, it doesn't confuse them. And I know it's confusing to all of us. So we want to do the most that we can to help prepare them. We want to give them time to think about what's going to happen and the opportunity to ask questions. We want to let them know these changes that they experience are absolutely normal. They should not be ashamed of them. And, especially if your child tends to worry a lot, it really might be a good time to have these discussions very gradually. Again, lots of repetition based on that need that they may have. Another thing that we want to really focus on here and helping them navigate puberty is to teach them about appropriate behaviors, whether they're in a private setting versus a public setting, because this can sometimes be a very difficult concept for some of our children with IDD to understand. So it's important to teach them about that, reinforce that. Just for example, something really small, always close the door when you're getting dressed and going to the bathroom. And so there are many caveats that this can take on, and how we can help them understand appropriate private behavior when they have special time, maybe in their bedroom, and or behavior that's, takes place in a public space. There are lots of evidence-based tools that are in plain language. They have, lots of pictures, that lots of things that can be modified just based on that person's needs. And there are a couple of really good curriculums that I recommend, and that's something certainly to talk with your provider about, and how you might could stage that curriculum to start, at a very early age, and then move forward based on how your child is moving through the transition of puberty. So I will list those two curriculums so that you have those available when we get toward the end of our talk. Next slide, please. So support for physical changes. Your child's doctor, your primary care provider, can be a tremendous resource for both you and your child during puberty. And hopefully that, you've had a primary care provider that has been working with your child over many years, and they have developed that trust and rapport. They can obviously not only help your child, but help you and bring you into the process of how these conversations happen. They can also give you lots of maybe resources for a specific therapist or counselor that you could use to support conversations going forward. If your child is having a hard time, say, dealing with menstruation, the doctor can help talk about options to help with pain management and or the control of flow of the menstruation, if that's helpful. They can also help address other changes that occur during puberty, things like skin integrity and the importance of cleanliness and hygiene, as well as acne that most of us are going to experience during that transition. You can also, start meeting with your doctor before they're starting to go through puberty, just to plan out that discussion. What does that look like? What are we going to expect? And thinking about, based on your child's needs, what are the best ways that we can come together and support that person with those physical and behavioral changes? Because we want information, tools, curriculums to be very individualized, to make sure we are addressing those needs specific to your child. Like their non-IDD peers, children with IDD are likely going to need your help learning about hygiene needs, things like using deodorant, the importance of cleanliness, especially with menstruation, how cleaning themselves, how to wear pads, or if they're going to be using tampons, how to work with being able to support them in utilizing tampons. They may need additional information about menstrual products, like I said, pads and tampons, how to find a product that they're comfortable using. So maybe some trial and error there to work on, about so that they're prepared about what they're going to be using to control their flow. Also, the doctor can help, if there's ever a need to talk about contraceptives. Our males might need information about what to do if they have a wet dream, and how to take care of their new body hair. So all children need to know about their bodies, and that they're growing, they're changing, and then how to care for them in a physical nature as they're transitioning to adulthood. So we want to make sure we're practicing good hygiene, using visuals or checklists or schedules, maybe picture books, maybe laminating an image of the body to serve as a checklist for those hygiene tasks. You could look at labeling hygiene kits to make those kits so that it's a good teaching tool, as well as maybe a bonding activity where you're supporting them and learning how to do that. Maybe you want to use just a plastic container or shoebox with specific hygiene items that are just for that task, and they can move from one task to the next. If your child has difficulty bathing independently, looking at what are those needs that they may need to have available to be able to do that more independently, like a bath seat or a removable shower head, scrubbing handles, anything that we can look at utilizing to help them practice that independence with their hygiene activities. And this is also an opportunity for maybe utilizing an occupational therapist or a physical therapist to take a look and give you some ideas about things you could do to make them more independent in that hygiene practice. Maybe you want to consider using a spray on deodorant versus a roll on deodorant. So whatever, again, we'll have to do some trial and error and see, what they feel most comfortable with. So those are all incredibly important. Some of the other things that you really want to think about is maybe looking at your school policies. What can your school help with, and what can they not help with? So, for example, say your female child is going to need support in changing products, like a pad. Is that something that they can get that support in school for them to go in, to the bathroom with them to help with that? So it's always important to know what they can and can't help with so that we can look at what arrangements need to be made to help with that. And then, of course, just working with our schools and our caregivers, they have so much support available in the school with your, school nurses, with your school counselors, that they can, again, help support you as well as maybe connect you along with partners to help you get those resources that you need for supporting your children. Next slide, please. So the next thing we want to talk about is the support for social and emotional changes. We talked about the importance of finding ways for your child to gain independence and physical independence and taking care of their hygiene needs, but they also need some support to gain independence out in the world, out with their friends, moving toward making some of their own decisions with your support. We want them to take part in school activities and develop healthy relationships. So this is a big piece we really want to focus on as they're, moving into wanting to have these friendships and relationships, and how they do that in a healthy way, and what are boundaries, and always, again, at the same time, in the back of our mind, when we think of defending against abuse, which we'll talk about shortly, because that is something we're always concerned about. But we want them to gain independence and take part in those social activities. Maybe help them plan a trip to the movies with a friend. Practice with their peers, and gaining those valuable social skills, such as greeting people, using eye contact and appropriate body language, respecting personal space, standing up for themselves, and understanding customs, for telephone and computer use, because that's one of the areas that we see or find that sometimes can cause problems later on if those specific understandings of what these rules are for those types of uses of electronic communication. People are really forming their identity here. As you know, just for you and I, this is a time where you have all these feeling changes, all these changes in your body, and you want to be accepted by people. You want to fit in. So we want to help them in developing those healthy relationships, but also, again, independent and, thinking for themselves are so important. You can definitely expect some conflict when you get to this age, as you know from your own experiences. And it's helpful if we just approach it calmly because we need to just process, understand what our child's going through, know that we went through the same things and approach it calmly. And as your child's seeking more independence, your relationship with them could start to include more conflict. So we want to, sometimes during puberty, we have our children want to rebel against parents or other caregivers because again, they want to be more independent. Um, and this is all normal and it's usually going to decrease over time. So we just have to hang in there with them and support them as best we can. Um, Parents and caregivers uh, might have to find some ways to balance privacy and independence while also, keeping their child safe. So, for example, you may want to have that conversation with your child about when can they have alone time in their bedroom for their privacy without being interrupted. That's an important time. And a lot of times they do want to spend time alone, solely with having privacy. Um, we do also want to acknowledge sexual and romantic feelings during puberty, because this is, again, just like our other non IDD peers, we're going to experience those same feelings. So we want to support them in understanding how these new feelings are, affecting them. We want to be talking to them about healthy relationships, the qualities that they might look for in a partner. um, we want to talk about consent and boundaries. And you may want to ask your child about what personality traits they, think would make the perfect partner for them. So that we can, really kind of develop what it is they feel like they want in a partnering relationship. And also, some children with IDD may not experience feelings or emotions in the same way as a child without IDD does. So, we may need to discuss feelings in a way that feels safe to them and meets them where they are developmentally. One of the things that I think is really important during this stage is that puberty is a time for all sorts of emotions. We need to help our teens express those emotions that they are having. Um, if they're able to communicate verbally or, use some sort of communicative device to be able to have those discussions, teaching them how to name emotions and become very aware of what those different emotions are and what that means to them. Um, we can use photos of facial expressions or, that they can use to show us. But do remember that teens with disabilities have a higher risk for mental health conditions such as anxiety, depression. So we want to keep a very close eye on our teens as they are transitioning through puberty. Sometimes they may have very extreme mood and personality changes, and we want to be monitoring them and looking for any of those signs and symptoms of anxiety and depression, and then talking with our healthcare provider on how we can help them better process those feelings. There are lots of different therapy models out there that can help us work through those different emotions that they may be feeling. Uh, Peer relationships. This becomes very important during puberty. Peer acceptance is one of the main focuses for teens as they're going through puberty. And some teens with special needs may feel their differences isolate them during this time and making it difficult for them to relate to peers. So we want to remind our teens of all the ways they are similar to their peers, discuss positive self image, and how our differences make us who we are and unique individuals, and to be proud of that. We want to discuss relationships, social cues, and social expectations. And then discuss peer pressure because, as you know, peer pressure can be and really ramp up during this time. And, if your teen has a negative experience relating to peer pressure, we want to, first of all, have them feel comfortable communicating that, talk through what happened, what led them to succumb to that pressure, the consequences of that, and how it could have been handled differently. So we, lots and lots of monitoring, catching on to these feelings, and having those good conversations. Keeping them involved in the activities that they enjoy, um, and helping them foster self-acceptance, allowing opportunities to meet other adolescents. And one of the things that helps is maybe volunteering with your team is a really good idea, because that helps you support them and getting those relationships developed, and then you can kind of step out for them. Next slide, please. This is a slide that I really wanted to hit on, because this is always one of my biggest concerns when it comes to having these, conversations, supporting our youth and making them strong. And that is defending, against abuse. We know that people with intellectual and developmental disabilities are more vulnerable and more exposed to sexual abuse. In fact, research shows that children with IDD are 4 to 5 times more likely to experience a sexual abuse than their peers. They are also less likely to report sexual abuse, and they are also less likely to be taken seriously when they do report. And so all of these topics are really important so that we can prepare our teams and help them defend themselves against abuse. 99% of perpetrators are someone that they know. So communication is key in preparing our children. We want to provide, again, open communication, stress that their bodies belong to them, and always, of course, be watching for any signs of abuse. It helps if we can explain bodily autonomy. They always have a choice about sharing affection with another person, and they are always allowed to say no. So maybe even they don't want to hug or kiss someone saying goodbye. That might even be grandma, but that is their choice. And so it's really, really important to stress that for our kids. We want to point out private parts and stress that people are not allowed to touch these parts without explicit permission. And private body parts are usually covered by underwear, their bras, or swimsuits. Again, using all forms of communication to be able to support them on whatever level of understanding they have. We want to use short, simple statements to discuss inappropriate touching, consent, your teen's rights, and how to handle uncomfortable situations. That's a really important one. We want them to know how to handle, what to do if they have a situation come up that makes them uncomfortable. And then sometimes it helps to make a list of trustworthy adults who they can talk to in an emergency or when they have a major concern. Um, Many parents find it comforting and teaming with their teen's healthcare provider, and we talked a little bit about that earlier, to have that discussion. So again, working with the provider, working with the school, we have lots of resources out there to support these conversations. Next slide, please. So my last big slide here is one that I feel is really, really important, and that is just to remember teens with intellectual and developmental disabilities are not asexual. They go through these same process, they have these same hormonal changes, they have these same feelings, and we need to be able to support them through. So they are going to have the same sexual curiosities and desires as teens without special needs. We want to make sure we're discussing, in the context of your teen's abilities, healthy relationships, sex, pregnancy, sexually transmitted disease risks, sexuality and gender. Oftentimes, this is a period of time, and where as people are trying to work to and discover their identity, There also become questions about sexual identity. And so we need to be able to support them through those feelings or thoughts and changes as well. We want to be able to educate them on how to handle situations in which maybe they feel sexual desire. Um, and how to, for example, when we talked about males and having an erection, about how they handle that, if they're in a situation and they do have an erection, how can they handle that? Discussing wet dreams so they don't think, they wet the bed, because that's oftentimes a lot, what they think, that they just wet the bed. So we want to explain that to them and help them process through. Reminding them again of those differences between public and private places and what those appropriate actions are. Make a list or use pictures if that helps as well. And we also, even want to be talking to our doctor about certain vaccines like HPV vaccine, pap smears, and things of that nature, because that's going to take a lot of preparation in supporting your child in those conversations and helping them understand. There are lots of ways that our providers can work with our families as well as our teams to make sure they are supported as best as possible. Next slide, please. I did want to list just one huge resource that I love is the Kennedy Krieger Institute. Has pages and pages of different resources for helping families and teens during that puberty transition process. And so I wanted to make sure I left the link on here for that because they are super wonderful resources. And I also wanted to mention the two curriculums, Elevatus and Circles. Those are both specific curriculums that are solely for youth and adults with IDD or other behavioral issues that may interfere with socialization. They do focus on teaching social boundaries, self-protection skills, acceptable behavior along the parameters of touch and talk and trust. And so they are really, really super good curriculums that you could work with your provider, maybe a therapist or even a school counselor. And what's nice about these curriculums is that you can really modify them to support the specific needs that your child has. And you can, again, break it down into sessions over a period of times to prepare them, support them during the time. They are just wonderful, wonderful resources that are evidence and trauma informed. So I definitely wanted to make sure I shared those two that you could talk with your providers about utilizing as you go forward. So these are the last of my slides. And again, I really appreciate the opportunity to be here and talk with all of you. Seisha is going to put my information, my email address, as well as my phone number in the chat. If you ever want to, reach out, or you have a question, or you're trying to find a resource, please feel free to contact me at any time. I appreciate you all and all the work that you're doing, and you supporting your children as they're moving through these different transitions. And here for you if I can help with anything as you are going through this journey. Thank you so much, and I will be available for questions for you.
Thank you, Christy, so much. I'm over here actually taking notes for myself because you are giving some really good information, specifically to direct language. I think that's very important when it comes to, encouraging and providing a safe space for adolescents. We want to make sure we're using the right terminology, and that sets the foundation. So that's a big thing. And I greatly appreciate you for even sharing that part. We have the question and answer period portion throughout the entire presentation. And if you look, you can see that it's circled Q&A. You could type in your questions anonymously. You can raise your hand throughout the duration of the presentation, and we'll unmute you at the appropriate time, and then you can ask your question.
We do have a question. Someone asks, on the subject of sexuality, my almost 13-year-old ASD grandson has been going through puberty for more than a year. He comments about people of both genders being sexy. When I ask him what that means to him, he says that they are handsome or pretty, or ask for my agreement. I try not to push him to be attracted to only girls, but ask him if there's anyone at school that he's interested in. He is in 7th grade and is very smart, but socially awkward. Is there a proper way to handle this discussion?
Well, I can personally say I think you're doing a wonderful job in what you're doing now. You're asking those questions. You're trying to get some clarification. You're supporting him, as he is trying to, work through his thoughts and maybe being able to better express those. I'm not sure if the communication skills, sounds like from what you said, he's pretty smart. So he's probably able to, communicate with you. I think, going forward, one of the things that can be really helpful, especially if you feel like your teen is really kind of maybe trying to figure out that identity, finding out, what he likes, what he doesn't like. You could always, get, talk with a school counselor or get a therapist that specializes in gender identity and so forth to be able to help support some of those conversations, see how he responds to that. But honestly, what you're doing is, I think, just super. You're wanting, you're encouraging that communication, you're supporting communication, you're making him feel safe in having those conversations. And I think you're doing an incredible job right now.
Thank you, Christy. I greatly appreciate your response. And that was a really good question. And I'm sure others have had the same type of theme of not knowing what to do and how to approach it. But as you said, the person who sent the question, they're already doing a great job. So thank you for that feedback as well.
Yes. But lots of resources out there. And I think too, like I know the Autism Society of North Carolina has lots of, different information on their website and tools about how to have certain conversations. So we could look at some of those tools as well. Also, sometimes those social stories can be really helpful in trying to, bring out a specific incidents where that may encourage more in-depth conversation on how your son feels too. Also, they have their autism resource specialist there. So they're always a great group to call out to and talk with family members who may have gone through some of those same things that you're going to through in conversations. And so to me, it's always nice as well to have maybe another family's perspective on how they handled it and what they did that was really maybe supportive for their child.
Thank you, Christy. I greatly appreciate that. And we're going to drop some of those resources. I believe Kim has been dropping them in and your contact information as we've been going on. So thank you. Thank you so much for that information.
Right.
I appreciate you. So next, we're going to talk about our giveaways. I kind of gave you a little teaser earlier to let you know that we are going to be doing some giveaways at the end of the presentation. And they're more so for, as you can see, fidget poppers, notebook. We have a water bottle, a fidget popper bracelet, a fidget necklace. So more sensory directed giveaways for our participant today. So look forward to that. And make sure, again, if you have any questions, drop them in the Q&A, and we will do our best to respond to them and answer them or provide you with direction on where we can get that response. So next up, we have Kimberly Charles. Kimberly Charles is a special education consultant and master IEP coach who works with parents and children with special needs to support them through special education process. Kimberly believes in that parents are the experts, which I think parents will agree with you as well, Kimberly. Parents are the experts on their child and believe that their full participation in the special education process is vital to success of the child. And that is so important. Kimberly has taught special education to children in grades K through 8 in multiple states over the last 20 years. She left the classroom to bring her years of experience to the other side of the IEP table, helping families secure the support of the child's needs in school. Kimberly has been a guest on the Autism Dad podcast discussing IEPs. That was a great podcast, Kimberly. I watched it. Amazing. Thank you for that information as well. Kimberly is an active member of the Master IEP Coach community and belongs to the Council of Parents, Attorneys, and Advocates. Kimberly holds a Bachelor's of Arts in Special Education from Clemson University. She will be discussing the 5 common mistakes of IEP that IEP teams make and how to address them, as well as to communicate effectively to individuals and providers who are assessing and implementing the IEP. Go ahead, take it away, Kimberly.
All right. Hi, thanks for having me. I love talking about IEPs, which I know is not, most people don't like IEPs and they cringe when they hear it. So I'm trying to, and I want to help parents feel better going into that IEP meeting and try to not have it be it's gotten to where sometimes it feels like it's the parents against the schools, and kind of how to help the parents bridge that gap and become a good team working together to support the child. So if you want that QR code goes to my website, and you can contact me through that if you have questions later. That's the kind of the easiest way to send me a message. So just a quick overview and then I'm going to go into more detail as we go. 5 common mistakes IEP teams make is not addressing all of a student's strengths. Every child comes to the table with social strengths, emotional strengths, functional strengths, as well as academic strengths, and all of those need to be considered. Asking for the parent concerns at the meeting. Goals that are not relevant or meaningful to the child's or the family's daily life. Behavior is not fully addressed, and that one is going to be really important during this stage in life, because behaviors are changing as their bodies are changing, as their hormones are changing. Then it's going to look different in school, and we need to make sure that all of that's addressed in the IEP, so they're not getting in trouble for things that are just happening to them and they're responding to. And then transition planning is an afterthought. And this goes looking into transition to adulthood. There are so many good parts of the IEP that, if they're utilized correctly, can support and really prepare the child for future education, employment, and independent living, which is the purpose of education. So looking into the first mistake is student strengths. Students' overall strengths, this is what the IEP says, students' overall strengths that contribute to success in the educational environment. A lot of times, and I remember being a teacher and then being told by the districts, you can only address their academic strengths in this section. No, it is, if you're a social child, all of those can help you in the school environment, and they all need to be addressed. So best practices including all strengths, academic, functional, social, and behavioral. And then what can you do as a parent to help the team make sure the team knows your child and is adding all of those strengths to the IEP? Think about it before the meeting, because when you're in that meeting and you've got 6 or 7 people sitting around the table and it's overwhelming, and a lot of times you can't think about all of the things that are strengths or the questions they're asking or what you wanted to say. So make list of your child's strengths and ask for that to be included in the IEP. And you can ask for it to be included in the IEP prior to the meeting. So when you're at the meeting, it's just making sure they got it in there instead of remembering everything and making sure they got it into the IEP. So, looking at the next one. This is parental concerns, if any, about their child's academic and functional performance at school. That's what it says in the IEP. And the common mistake is asking for parents' concerns at the meeting. Again, they say, well, Mom, Dad, caregiver, what are your concerns for your child? And a lot of times I would have parents, if I asked in the meeting, say, oh, I don't have any. And we all have them, no matter if our child has a disability or special needs or not. We're parents, we have concerns for our child. But when we're put on the spot and everyone's looking at you, it's hard to remember them or articulate them the way you want to. So best practice is that school says, ask the parents to send their information ahead of time, or has a discussion with the parents ahead of time, or the families in the background. A lot of times that doesn't happen for whatever reason, but families can always send their own letter in writing to the school team before the meeting. So when you get that invitation, a few days later, send back a letter that articulates all of your concerns, everything that you're worried about and that you would like addressed in the social, behavior, and academics. You have the ability in that letter to suggest accommodations that you think might help, to suggest goals that you would like them to work on. This is truly the family's time and the family's voice in the meeting, and it is the second thing that's discussed. So making sure that your voice is heard in that section can then help drive the rest of the IEP. So then looking at the next one, goals, and I think I should have probably just gone with what mine, but okay, goals that are not relevant. Academic and or functional goals designed to meet the student's needs. Common mistake is creating goals that are general and not based on the student's specific unique needs and life. So one of the things that I always use as an example of this is an analog clock. Yes, there's still lots of analog clocks in schools, but there's also digital clocks. And in a lot of our homes, we don't have analog clocks anymore. They've always got access to a digital clock. Is that skill the one that you want to be a goal for your child? Is that so important that it is a goal in their IEP? And if it is, then that's great. But for most of us, we all use digital clocks now. That's probably not something that needs to be a goal. Let's focus on reading and understanding a digital clock if that's not what they know, because time is important, but how they read it may have changed because of today's society. And then best practice in making goals is using the parents' concerns and vision for their child's future, their student strengths and needs, to write the goals that are relevant and obtainable for that individual child. So really, truly not looking at the curriculum that is for whatever that grade level is, not looking at, well, most of the kids in this class are working on this. What does your child need to be successful or be prepared for future education, employment, and independent living? And that is the purpose of special education, is to prepare for those future needs. And just the goals are the most important skill, and they're what their specialized instruction will be addressing. It doesn't mean that it's the only things that they're going to be learning or working on. And then what can you do? You can take an active role in the goal creation. You can, like I said, you can suggest goals. If the data doesn't show at home, doesn't seem to be what they're saying your child can do, or if it's too low and your child can already do that, take an active role in that and really have that conversation and communicate with the school. The next one is behavior. And this is where I think, especially in middle school with puberty coming, a lot of times your child's behaviors are going to change, and those behaviors need to be addressed in and supported in the IEP. So they're not getting in trouble for things that are typical that they're reacting to. What the IEP says is, does the child have behaviors that impact their learning or the learning of others? This is in the special consideration section of the IEP. And a common mistake is not fully addressing or discussing the behavioral needs of a student. Just because a behavior that, like, the child is not throwing desks or they're not showing a lot of outward behaviors, there may be more inward behaviors, more things going on that are impacting their education. And so that needs to be discussed. Maybe it's not, maybe they're not showing those behaviors at school, but something's happening at school that's causing them to be very frustrated at home, and the behavior comes out at home. That is still a behavior, because if they're sitting at school getting so frustrated and quietly holding everything in, they're not able to learn and feel good in the environment that they're in. So the behaviors that are happening after school impact the behavior, impact this section of the IEP. So again, that communication from home. And I know a lot of times it's hard to share what's going on at home because you just want to handle it at home and you don't want, but it's important for the school to know so you can work as a team to support your child. And so that's the best practice, is having that complete discussion and requesting an FBA if there are concerns. So even if your child's coming home from school frustrated and overwhelmed, throwing a fit at home, you can still request an FBA, because things are happening at school that are causing that to, those behaviors to happen at home. And what behavior is your child showing at school that might be missed? Maybe it's putting their head down. Maybe it's closing their computer. They're doing things. And so a functional behavior assessment will really look at what's going on at school and what the teachers and the adults are doing before and after what appears to be the trigger events. And what can parents do? You can start the discussion and communication, and sharing that information with the school so they know what to do. And you can share your own data. You can keep data on any goal that your child's working on and share your home data with the school, just like the school should be sharing their school data with you. Transition planning. This, so the purpose of the IDEA is to ensure that all children with disabilities have available to them a free, appropriate public education. And then there's a lot of other things in there, but that is designed to meet their unique needs and prepares them for further education, employment, and independent living. When a child in North Carolina turns 14, that's when the transition to adulthood, is officially started and started to be discussed during the IEP. I feel like, especially in the middle school years, the transition plan is treated as kind of an afterthought of, oh, we need to do this really quick. And just, it really is important, because the things that you're doing in middle school and thinking about in middle school, they can join clubs, they can start looking at different activities and ideas of what they might want to do. Most kids, we don't know what they're going to do, but thinking about what their interests are will give them that opportunity to explore and prepare better for high school, when you want to really be giving them more education and more support in those transition to adulthood skills. So, but the best practice is the parent and child's vision for the future drives the transition plan, and it's fully incorporated in the IEP. So once you're in high school and you've got a vision of what the future is most likely going to look like, are they going on to further education? Are they going to go into supported employment? Are they going to go to day programs? What do you see that future looking like? then goals and everything can be put in place that can drive the rest of the IEP. And preparing prior to the meeting for the transition planning discussion. So parents coming in prepared and sharing even ahead of time, or families coming in prepared, is always the best way for families and parents to get their voices heard and included in the IEP. Because parents, families are equal team members. I know, and a lot of times it doesn't feel like that, but you are an equal team member on that team, and you are the only member that will be there for the entire ride. So teachers, administrators, therapists come and go, but as the family, you are the one consistent member that has known the child. And so that's an important piece where you are the expert and your voice needs to be heard. So looking at a little bit more into the transition plan and post-secondary goals. I know we were kind of more talking about middle school, but I feel like we can't talk about middle school without looking at that transition plan, because that's the next step. And transition planning has to be included, like I said, when the child turns 14. And at that point, they kind of just ask about simply, will your child pursue education beyond high school? Are you that doesn't mean just any sort of education beyond high school. Are you looking for training programs? What is that? What does employment look like for your child after high school? And that can include even part-time jobs in high school can support where you're thinking they're going to be going. Are there programs to volunteer at in an area of interest? And then independent living. Where do you see your child living for the first few years after high school? Will they stay, are they going to be staying with you in your home? Are they going to maybe be in a dorm type setting? Are they going, what are those things? Because that's going to be important for what the functional goals and skills are for everyday living. Preparing for the transition discussion. Parents need to make sure you're preparing and thinking about that transition discussion before you get there. So you can have your voice heard and you can kind of be requesting things that you think will support your child. So the first thing, and it's kind of the first thing we talked about before, list your child's strengths, interests, likes, and dislikes. If they don't like, there's opportunities for every person, but for example, if they don't like dogs, then a good place for them to work would not be the Humane Society. You need to think about what your child, but if they like dogs, then maybe there is some opportunities to work with animals. So just thinking about what they like and they don't like and what they're interested in. What is your vision for the first few years after high school? So making sure you know what you see happening for your child those first few years after high school, whether it's after 18 or after 22, what do you see happening in those first few years? Where will they live during those years? And it could be you don't have to know for sure. And you could have a couple different places. Oh, I'm thinking about this and this. So we can prepare them for either way. We can look at the IEP and make sure that that's happening either way. I lost my spot. What transportation will they use? Are they going to be driving, or are they going to ride the bus, or will they use Uber? What train? And those, they can be taught how to use whatever that can be part of their IEP, using the transportation that they're going to use in the future, teaching them how to do that now, so they're independent when they leave with that, or as independent as possible when they leave high school. What do you and your child view as important skills to reach these goals? So again, if they're going to ride the bus, then they need to know which buses to get on to go where they need to go, how to communicate with the bus driver, how to pay for the bus, how to do all of those things. If it's Uber, they need to know how to use the app and how to make sure they're safely getting into the right car and all of those things. If they're going to get their license, what are the steps for doing that and how can the IEP support them? And then this sixth one is what can they do during high school to help them explore opportunities and prepare for their future? So that can include goals. It could, maybe it's a part-time job, volunteering within the community, job shadowing, just lots of different opportunities to explore, and clubs in high school. So talking with the team so they can help you find opportunities for your child to explore their likes, interests, and dislikes. Well, we don't want, I mean, maybe they'll find out they don't like something and that'll be a new dislike, but just exploring things so they have some ideas before moving to the next step. And then I would love to support you in any way. If you have questions, you can, try to share helpful information on my Facebook and Instagram. And again, if you need to get in touch with me, my website, and on there's the link to the Autism Dad podcast if you want to listen to that as well. So, and any questions, I'm happy to answer as well.
Thank you so much, Kimberly. I greatly appreciate it. I've also taken notes as well. And the one thing I want to tie you and Christy's presentation to, you both specify, basically you're following the individual. You are following their track. We can include our information on what we want, but it's based solely around the individual and their preference, accompanied with us as parents and caregivers, but that's who and what we're doing it for. So I just wanted to say that was great information. And again, Kimberly Lambert has dropped Kimberly Charles's information into our Q&A. Into our chat box if you have any questions, and make sure that you utilize your Q&A.
We do have one question, or actually another one. It says, do you feel it's important for all children with a diagnosis of ASD to have a IEP, especially if they are very high functional intellectually in AP classes and fits in for the most part? I am the same one who asked about the sexuality in the last segment. He is my grandson, and I have custody of him. His IEP was dropped in first grade because the only goal at that time was learning how to hold a pencil and scissors properly. He has a 504 now, just because last school year he had a few emotional breakdowns at school, and just so he has an option if it should happen again. It was determined that it was mostly hormone related.
So that's a good question, and definitely an area that I get a lot of questions about, because a lot of times, again, the schools want to say the IEP is solely for academics. And obviously this child is doing very well academically. The IEP can also address executive function skills, social emotional skills, and accommodations can be added. The 504 is just that accommodation piece that is that may be enough for. So it really depends on the individual is, I guess, the answer. If they need specialized instruction in even if it is executive function skills or socially, then an IEP is needed because that is the specially designed instruction. A lot of times those kids do need specially designed instruction in executive function skills. But if they are able to if their executive function skills are good and they're on top of their work, and that they may not need an IEP. And the 504 may be enough. I'm sorry, I think there's somebody walking by the house. Don't know.
There is a second question. It says, what does the acronym FBA stand for? I apologize if I missed it. Addiction is my specialty.
It is a functional behavior assessment is what it stands for. And the functional behavior assessment should be used to create the behavior intervention plan, or the BIP.
Thank you, Kimberly, for taking those questions, and everyone, I want you to continue to utilize that Q&A. If throughout the duration of this presentation, something might pop up and we might have passed that subject, please still feel free to go ahead and put your question in, okay? Our next portion, which is, everyone is my favorite, everything's my favorite, but I love this part because it ties us back into normalizing what we're talking about. We have two parents that are either went through this transition, all the transitions that we're speaking about, or are in the process of going through them. First, we have Carrie Bumbarger. She is a mother of a 21-year-old son named Trevor, who is diagnosed with autism and has medical needs, including a feeding tube. She is also on the board of directors for Amazing Grace Advocacy Group, which is based out of Cabarrus, but covers and serves other portions of North Carolina. Then we have Magnolia Elgulera. Did I get you right, Magnolia? I want to make sure. And she is originally from Peru. She lives in Cabarrus County. She's been here for more than 20 years. She's the mother of 3. The youngest of all is 16 years old and has Down syndrome, has been diagnosed with Down syndrome, autism, and other multiple disabilities. She also has worked as a DSP, and she leads a support group for parents with children with different types of disabilities called Angeles de Esperanza, and collaborated in different projects and with different organizations that support and benefit families like hers and yours. So I want to thank, first off, I want to thank Carrie and Magnolia for even agreeing to participate. And I have a couple of questions that I'm going to bounce off of them. And again, if you have any questions for them, you can put them in our Q&A. So Carrie, first to you. I wanted to know, what is the importance of maintaining a good relationship with your primary care physician? So as we spoke about that transitional period with puberty, and we spoke about the communication, how communicating some of those behavioral needs or behavioral changes as well as physical changes. What do you feel was the purpose or the importance of having that good relationship with your primary care physician?
Oh, I think that's highly important because there wasn't always things, having a boy I wanted to answer or talk about. And so having a primary care that was a male, and I would step out of the room and let them have their talk. And he was very good at talking about if someone touched him, if anything, and he would ask all those questions. Have this happened? But he had him from, when he was born all the way through till he turned 21. And I think that relationship starting young also helped. But he started real young, asking those questions, recommending the vaccines, which we did, the HPV. And even though you can't envision it at a young age, anything happening, but just having that discussion. Sometimes he'd have a slight discussion in front of me, but usually that's when I would walk out of the room. And I just felt, and even my son would step up and say, okay, I want to talk in private. And during those yearly visits, because usually a little bit more time frame is given. And that's the other thing parents don't think about asking, and I'm going to touch on that, is sometimes when it comes to our yearly visits, we need, with the special needs, more time. And so you need to go in, and sometimes the doctors have to approve that. So you need to go in. Of course, now we have where we can, send emails and stuff, but insist that you have the extra time. Now that's going to take longer to book out. So you want to make sure you do it way in advance, but you don't want that 15 minutes, especially for the yearly. Whether they have, my son had a lot of medical issues, but whether they have that or not, to be able to have that time to talk and the doctor not feel rushed. So it's like really important on every, and that the physician understands their, background, you know, I recommend, but that's all I had for my son, is a pediatrician. They seem to have more empathy, and, you know, you kind of want ones that have had, you know, autism or special needs experience as well.
So some type of background that makes
Mhm.
that makes so much sense, and it's so important to even speak on that you want someone who is a specialist or has some type of knowledge and empathy as well as patience with communicating. That is 100% true, and I couldn't even, for myself, you know, you want that doctor as well, but more so for someone who has some type of difficulty communicating and verbalizing some certain issues. Magnolia, I want to ask you the same question. What do you believe the importance of maintaining a good relationship with your primary care physician? What are some important things about that? You're on mute. No worries.
Okay. Yeah, for me, it's very important to have a good communication with her because I am the voice of my girl because she's unverbal, and I know, and I have, well, I learned how to understand her. So, because it's difficult for her and difficult for me, but I have to, I know when she feels, when her period is coming. It was wow, it was huge for me to understand how she feels because she's starting like having those breakdowns, like having anxiety. The she takes medicine to sleep at night, and the medicine was not working for her, and I didn't know what's going on. Even I was giving her the medicine, she was awake for the whole night. So I talked to the doctor, I asked questions, and I had to tell her how my daughter feel, how she feels, how she's reacting when she got through her with her period. So she referred me to another doctor, to of the gynecologist. I'm sorry, it's hard for me to say that.
Me too. Got gynecologist. You're totally fine. Go ahead.
Yeah.
Fine.
Yes, and I talked to this doctor and talk about how she feels. So, and now I'm talking with the development doctor, a behavioral doctor, because she's sometimes when she's on her period, she have those breakdowns, and she's very anxious at when it's time to come. So I know when it's time to come for her. The 3 first days is like very bad for her. She's very anxious. She can't sleep. She hurt herself. So but I think we talk to the doctors is very important for me, and so we working together to help my daughter to get through to this process.
And that's important too. You even brought up another part with me, just, you know, that hormone imbalance. And sometimes, you know, not having an added disability that can debilitate an individual, a person, because if there's a hormone imbalance, you know, we might need some type of other medication to balance out, or whatever may need, or some other intervention. So it's very important that you know, that's an added task, I should say. And hats off to both of you, and hats off to you specifically, Magnolia, for having to, you know, you have to monitor and track that and then communicate that. So that's good that you do have a real good relationship with your PCP, so everyone can be on the same, you know, level and be able to, you know, go outsource or refer you somewhere where she needs additional help. So very, very important. My next question, I'm gonna go back to you, Carrie. What was the, because you have went through this portion in reference to that IEP, the transitional phase, what do you think the most important, why do you think that is so important? And I know that you you beyond that part, but do you think that it had anything, did it help you? Did it help Trevor be set up for success during that transitional phase?
That one's a little bit hard because we hit COVID when he graduated.
Oh,
So
yeah.
that changed everything. But I think the good thing was that he was in the meetings. So he could kind of talk about where he wanted to be. Where he wanted to be and where I wanted him to be was not the same at all. So that is hard as a parent to let that go. I wanted him to be in a different, complete spot. He wanted to graduate, have his own apartment. Okay, who's going to pay the bills? I'm not going to be your housekeeper, you know. Now it has changed. He wants to live with me forever. And I'm rolling my eyes over that. But we've come up with possibly getting a different house where there's an in-law suite. But all of it has changed, but at least setting him up as to start working. And that was the first kind of thing that we had. Of course, where he wanted to work was kind of like out of the scope, but give him that chance to work towards that. Me explaining you can't just go from A to Z. You know, we've all in life, you know, me explaining, hey, I had to start at Pizza Hut. You know, you don't get to go from this to this job and trying to work with them, but we have to set the goals to get there. And so with the IEP, it was allowing him to have that voice, even if the goals weren't kind of I consider realistic, but at least he had something to work towards. And also that they could see where he was thinking, what he wanted to do. You know, he said he was never going to attend school again. And that's not true. So right now he's at RCC. But so it's good because it led him to these goals. It took a while from, you know, the COVID, going through all that, to 2023. So even though he said different things then, he still kind of had those goals or those things he wanted to do in the back of his mind. And as he got older, he realized, oh, wait, for me to do this, I have to go to school, or I have to try this, or see if this works. And, you know, he did one thing and he tried for quite a while and it wasn't working for him. So I said, okay, well, that's the whole point of these goals. Keep trying, but setting that up, letting them work for something, I think is really important. IEPs are always fluctuating too, you know,
Yes.
even if they start out this goal, they may be in school and 5 months later. But I think even the kids setting at that age, taking part of it and setting it.
Because you set that foundation. You start off with that foundation, and then, as we said before, things change. But if you aim up here, if he's up here and you're right here, then you can kind of meet him where he's at. So that's the importance, what I'm gathering, and kind of knowing it personally, that you allowed him to drive this, but it had to have a foundation, and that IEP kind of set the parameters of what you can do or what he can do and how to advocate for him.
And that was the thing, is which, like, I was always trying to teach him to advocate. But with the IEP, I think that's the thing that helped, because he started knowing what was in his IEP. And he would say to me, Mom, they're not doing their job. Or he started sending the emails. I kind of had to rein him back because they kind of came off as a certain tone. So I would say, okay, set it up, draft it, let me read it, let me explain to you. But they weren't doing something, they weren't following something, he was all over them. So having that kind of teaches also to advocate. So when they're feeling they're not getting something, all right, I want you to handle it.
Gotcha. Okay, thank you, Carrie. I greatly appreciate that feedback. Magnolia, same question to you about the IEP in that transitional phase. Do you think what was the most important thing or phase or part of that planning phase for your daughter?
Well, well, I was hoping that that my girl could tell me that they're not doing their job. Yeah, because well, when now she's in high school, but the transition to elementary to middle school, it
Mhm.
was great
Mhm.
because we had a great team with the teacher, all the people was working with my daughter. We always had the communication, the same goals and everything. Yeah, unfortunately, when she started high school, it was in the middle of the COVID, and it was very hard for us because I think we had the IP meeting by phone. The teacher just worked for 3 months. After they changed a new one, then they continue changing. This new year, this beginning year, she have another one. I hope she's going to work for her for a long time, because the changing for her is very hard, because it takes time for somebody to understand my daughter, but she cannot communicate, and it takes time for my daughter to
Feel comfortable?
feel comfortable. Yeah, because if she doesn't know the person very good, she just ignore it and refuse to work and make her goals. Because I noticed all the work or all the success she was having,
Mhm.
like we was working together in one goal, like she can walk, she start walking when everybody told me that she's not gonna walk, but we one of the goals, because it's very different, that she has a lot of difficulties. So she started working at the school, and we work with the teacher that encouraged her to walk more, and then she started grabbing her spoon by herself, and it was a goal between us. But when she started high school, everything changed.
I can only imagine. But it sounded like what you were doing, she had a goal that wasn't technically related to school. It was, even the walking and everything, and becoming more independent. But that was, you were able to see the progress in the school environment. So
Yes.
even though, and this is a little outside of the IEP, but that's going back even more so to the communication and you being a great advocate for her, because you were able to see the growth in her. And we all know that high school does change everything, no matter what we're talking about, what subject, but it changes everything. But you already have like a foundation in place for her, so you're able to advocate for her as well and see a difference and maybe ask for some changes or whatnot. But she has the foundation, it sounds like. So it is
Yes.
important to help with that foundation. I think, yes, it is. It has to be. My last question, I can go with you, Magnolia. My last question, and then I'm gonna bounce back to Carrie. Knowing the information that you know now, like, you have went through some of the processes, would you do anything different in reference to like an IEP planning meeting or planning IEPs or involvement, as well as anything in reference to like that puberty stage? Would you do anything different? Would you change anything?
Well, I know I have to communicate more than, well, I want now meet with this new teacher and set a goals and work together with her and see if we can go back where she was before, because I see that she was stuck back.
Kind of regressed a little bit, kind of went back
Yeah.
some.
And yes, so that's what I want to do for my child now. Like I want to I was hearing that write what I want to to talk about the IP, be prepared and be and make them doing the work. And I want to tell them that I want to complete all the goals I have for my child, because I know my child have a lot of difficulties, but I want her to be more independent, or the most independent she can.
So what you would do, I'm sorry, and I just wanted, because I'm on the same page, I think, as you, what you would do is make sure that you advocated more, because you know that she can do the work, and you know that she can make progress, but you would want to make sure that you spoke to the providers more, or maybe kind of with a little bit more like focused, or on those goals, and making sure and holding people accountable to ensuring that those goals are being completed.
Yes.
It sounds like my life. So if I knew what I knew now, we could do things differently, but we do the things, for a reason. And so now that you can share that information and be a support to other families, so I totally understand that. Carrie, I have the same question for you. Knowing what you know now, would you do anything different?
The high school IEP, I think I was kind of okay on, because he was doing better in high school, but he had a lot of like jiggling the leg and stuff like that. And I think that's where, even though I kind of would go in there, say that, I would advocate more maybe for his tics, even though I'd bring it up, and the one teacher was like, it's a distraction, him shaking his leg. By the way, he still does that today in the car. Drives me nuts too, but I'm like, well, I wish I could do that and burn all those calories, but they, the one teacher would just get really, really upset. And I think I wish I could have, even though I talked to her. But middle and elementary school IEPs, I would do it all differently. I didn't know as much then. They dropped him in elementary, even though he had an autism intellectual, and I had, all the documentations. And I just kind of went back and forth with him. And it wasn't until he was getting ready to go into middle school, and I said to him, to the elementary school, why do you care? Just give him an IEP, give it the last day of the year, and just get me an IEP. That's literally what they did. That's how I got. But they just pushed him through, even though I kept getting calls from teachers and would say this and he would do that, and they had sex ed, and then he thought the word penis and vagina was funny, and he said it, and then they wanted to suspend him from school. And I'm like, well, did you tell him not to say the word? Because that's all it would have taken. And it was just small things like that. In middle school, they were having problems, and I went into the school and walked in every single class with them. Every single class. By the time I got home, I was into a full migraine, and I said, oh my gosh, now I know what my kid goes through. That did help me advocate better, but I kind of sometimes wish I would have done more of that. Go and sit in the classroom. I could hear like buzzing. I could see kids jumping out. The one teacher was like, kids would be like, well, you weren't really there, and talk back. And then she would like argue with them like she was on their level. And I'm like, well, kind of, he's going to do the same thing, I feel. But she comes up to me and she goes, normally I don't scream at the kids like this. And I'm thinking, I'm in the room and you're screaming at these kids, So more middle school. High school was different because he was in the OCS program, and they did not believe in sending homework home, thank goodness. And because of that, I could deal with other things because he had a lot of medical and his PT and speech. So in middle and elementary, he'd have all this homework, and then he had to go do all of his medical. So high school to me was so much easier.
And honestly, Carrie, I understand that, but I think that you might be one of the only parents I've heard say that high school was a little easier. I mean, middle school was a little easier. So it's good. I mean, it's good. That means that was a good transitional phase. And so I think what you were saying is you advocated for him, but you would do it in a different way. you would do it, you know, you did your due diligence, you went into the classrooms, you observed, you did your own kind of like mom observations, and you saw things and you did address them. And some things are out of our control, but you know, you probably would just advocate in a different way for him. But I think that even just you speaking about him being able to advocate for himself, you did a really good job. You know, he's being able to speak on his own behalf, even with some monitoring, but it's a good attribute to have. So thank you. First, I want to thank everyone.
Can I touch on one thing
Yes,
now?
go ahead. Go ahead.
So Trevor did a recent podcast and I was not there because he knows I'll talk for him.
Yes.
And so I wanted the parents to hear his words, because this is something that got me real emotional, because, you know, just when you think as a parent, you know, there's days was in my closet in middle school and elementary crying because I didn't want it for a day, and then I didn't want him to see. And I think we're all going to have those frustration days. But in this podcast, one of the questions they asked them, words of advice to parents, for a child's, would you give child's autism diagnosed? So he wants to give words of advice to parents. And his words were, I say, don't give up. Because I mean, you're the parents. They stick up for their children no matter what. They have to take them, like even doctors say something that's not possible, that they can't do. I personally wouldn't like what they told me, and they were on about me. So I would so some of these words, this is being translated. I heard the podcast, it came out a little bit different, but so I would just keep going. I mean, it's going to be very stressful and hard on their lives, but they have good moments with your children and they're excited for their future no matter what. So that's coming from a 21-year-old with medical and autism, telling parents to keep going even through the difficult times, that basically they're seeing it.
Okay, you're gonna make me tear up over here, but that's okay. But those are words that's needed. And if you don't mind, I want to share his podcast. You send me the link, and I want to, so everybody else can,
Yeah.
you know, it's great. That's so great. And right there, that just summed up everything. Honestly, this whole entire session was with Trevor's words to not give up and to keep going. And what you as a parent you're doing, children see it, you know, and they know that they are supported. And those tired, sleepless nights that you had in the closet, you said crying, it was worth it. Maybe not the headache afterwards or whatnot, but it was worth it. So you did your job. And that's the whole point of these meetings, to provide those resources and to ensure that parents feel supported, how your son feels supported. Because clearly, even though he didn't tell you every day, those words right there just showed you that it was worth it. Thank you, Carrie, and make sure you tell Trevor I said thank you as well. Okay, and I thank everyone today. We're running up on time, and I want to make sure I sum up before I start tearing up. Thank you, Carrie, for the rest of the presentation. And we are coming to the end, and we can go back. Yeah, and so we need your help. We need your help. Please take a moment to complete our survey. It will only take a few minutes. This information gives us insight on your interest and what we can do to improve ourselves. It's important. If you want to let us know a topic that you want to hear, or you want us to touch bases on, we can definitely include that in our next planning session. So this is very important for you to drop your information into the survey, okay? And while you do that, I want to just tell you some brief information about us at the Member Engagement Department. We are the member engagement team. We provide customer service as an extension to our call center and support members' empowerment initiatives. We offer resources, advocacy, education, navigating through North Carolina's busy and sometimes complicated public health department, as well as IDD healthcare system. The member engagement staff work together with individuals and families and agencies in our communities that directly support them. We have our member engagement line is 704-884-2888. 2729. And we'll drop that in the chat. Kim just did. And then next is our contact information for partner access. You can contact our partner access line at 818-235-4673, Monday through Saturday, 7 a.m. through 6 p.m. And that access, I kind of like call it like the gateway into partners, because you will have access to all members, to all departments, as well as additional resources and information. We also have our behavioral health crisis line, open 24 hours a day, 7 days a week. That number is 833-353-2093. And as I mentioned earlier, our member engagement department, the number is 704-884-2729. And we're available Monday through Friday, 8 a.m. to 5 p.m. And if you have any questions, you can also email those questions to memberquestions@partnersbhm.org. Want to be in the know, stay connected, and you can visit our website and subscribe to our upcoming trainings, events, and certain news in partners happening here. So ensure that you you make sure that you go on our page. You can stay up to date on all the latest information. And last but not least, we're going to do our giveaway. And we have the fidget poppers, a notebook, a water bottle, fidget popper bracelets. We have just more sensory items, and we have a fidget necklace. I know the fidget necklaces and the fidgets are kind of a popular item. A lot of the kids use them, but I have found myself utilizing them as well. So I can go ahead and announce our winner for today, and I'm going to give you a drum roll. Wait, let's see what I can do. Can you guys hear that? Nope. What about this one? Yeah? Yes. I've been practicing. So we have our winner, and that is Jan Combs. So Jan Combs, you are the winner of our sensory giveaways, our items. What you can do, we have your email address and everything, so we'll email you with and request your address to where we could send everything to. And again, thank you for participating, and congratulations, Jan Combs. And thank you everyone for participating. I want to give a special thanks to our keynote speakers, Christy and Kimberly. Thank you so very much for giving us this information and providing these resources and supports for our families and communities that we serve. I want to thank you, Magnolia, and I want to thank you, Carrie, for bringing this all together for us and letting us know that, sometimes it can get difficult, but there is a light at the end of every tunnel. And I want to give a special shout out to Trevor, even though he's not here, for those words of encouragement. And I greatly appreciate everything that you both do for your children. And I want to give a shout out to our team who's been manning everything and keeping us together. And I want to thank all the participants for participating and coming in and getting this and receiving any knowledge. Again, if you have any questions, concerns, or you want to, provide any feedback, please complete that survey, as well as visit us at partnersbhm.org and subscribe for our monthly events, such as our member cafe, our community cafe. We change our topics monthly, and we want to make sure that you are surrounded with information and support and resources. Anybody have any last thoughts before I let you go and enjoy the rest of your great Saturday? Well, I'm going to say thank you, and until next time, we'll see you again. And you enjoy your day and your weekend. Thank you.